Hi, welcome back to the channel. My name is Molly, and today at Live UTI Free, we're chatting with Kate Arnold about gut health and recurrent UTIs. If you're new to our channel, be sure to check out the description below as we've linked to other resources that you might find helpful. Lastly, if you enjoyed these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you get notified when we post new videos. And other than that, we hope these videos provide the insight you need to take the next step on your UTI recovery journey. Hi, I'd like to welcome Kate Arnold to our Clinician Insights series, where we discuss different approaches to recurrent and chronic UTI. Thank you for joining me today.
Oh, it's fantastic to be here. Thank you for having me.
Thank you. Yeah. So to start off with, our community would love to learn more about you and your practice. Can you please share some more information about your background?
Yes, sure. I've been a nutrition consultant for probably 25 years now. It's a long time. And my previous career was actually working in finance in Hong Kong and Jakarta. And I got very unwell. I got completely burnt out. So I changed my career, and I've been doing this now for, as I say, about 25 years. Um, Things have morphed over the years, I think, as particularly as the science around nutrition has got more robust.
Mhm.
Because certainly when I first started, a lot of what we now know to be, completely, true and discussed, like the microbiome, wasn't really there when I first started. So things have changed enormously. I work as a private practice. I specialize in something called the lifestyle medicine, which sounds a bit complicated, but it's not. It's basically looking at the body as a 360-degree human being, as we like to be treated. So we're looking at trauma, inflammation, gut health, stress, diet, sleep, hormones, etc. And I have a particular specialism in the gut microbiome, and that has morphed as I became more interested in it. So, I treat a lot of people with a lot of illnesses, but as you're probably aware, the gut microbiome has its little fingers and paws in all of our health. So that's what I specialize in.
Yeah, amazing. So what is your initial approach when you're meeting a patient with recurrent UTIs?
Well, it depends on where they are in their journey, and it depends obviously if they're with a consultant. I can see two types of patients, and what is alarming to me is I'm seeing more and more. So my role obviously isn't anything to do with antibiotics or diagnosis, it's
Mhm.
to do with support. So often there'll be two types of people who come to see me, often mostly women, some men, mostly women, will come and see me. And just going through the consultation, they will say, oh, well, I've been diagnosed with overactive bladder because I pee 15 times a night. And I'm thinking,
Mm.
that doesn't sound necessarily like overactive bladder. Or they may say, I'm sure I got a urinary tract infection, but my cultures keep coming back negative. So if they haven't seen anyone and it's really impacting their life, I will suggest that they go and see a consultant. So there's those types of people that are just starting on the journey. If possible, if it's really kind of a simple UTI situation, I might write to the GP and say, look, Sarah is peeing 15 times a night and we haven't done a urine culture. Should we just do one anyway? Sometimes it comes up, most times it doesn't. And then the other types of people I see will be those who are under a consultant, and obviously they're 5, 6, maybe 10 now in the UK, who are excellent at recurrent and chronic UTI and understand the complexities of this condition. And I'll see them, and they'll be maybe 6 months into treatment, or a year, or a few years into treatment, and they're obviously really worried about their stress levels. They're worried about the psychological impact it's having on them, and they're really worried about their bladder, vaginal, and gut microbiome. So
Mm.
they've got all the expert advice with the Hiprex or the antibiotics, what they've got, but then they are still really worried about obviously the impact that this is having. So when I see those types of people, what I tend to do is sit down and go, okay, so for you, one of your main issues here is stress, and we have to deal with stress. Or for some people, it may be that they're having recurrent thrush, or they're having really bad IBS symptoms, or they've had diarrhea. So it depends. So it's really a combination of two sets of people who haven't started on the journey, and I'll direct them somewhere, or people who are on the journey but have sort of maybe side effects, or they want to try and get themselves to the healthiest versions that they can.
Yeah, I think that's really interesting, and it's important to have, because so many people are on different journeys, and
Yeah.
what works for one person doesn't work for another. So yeah, that's really important. So do you investigate a root cause, or do you look at other factors that could be contributing to UTIs?
Yeah, I mean, root cause is interesting. So again, I mean, wouldn't it be lovely to say everyone's the same, but we're not, we're all
Mm,
individuals. So root cause is complex. Sometimes it can be fairly obvious in terms of there'll be a perimenopausal or a postmenopausal woman whose estrogen levels are going down. So,
mm,
I may get them into the GP and say, look, let's get some localized estrogen while this is fairly early on in the days of diagnosis. But often I see women who have had vaginal atrophy or vaginal dryness for 6 years and they haven't been offered anything, and now they've got UTIs. So I think the root cause is very different for a lot of people. It can be
mm,
genetic. I think all the biomes come into play: the vaginal microbiome, the bladder microbiome, and the gut microbiome, and they will all be completely dysregulated. They will all be upside down. There will always be a kind of a leaning towards bad bacteria than good bacteria.
mm,
And I think if we can get the balance back somehow, which is really hard, because obviously people who are taking constant antibiotics we're sort of fighting against that. But usually the root cause is either genetics, huge stress, trauma. I don't think really you can blame it on necessarily a bad diet. I think that's too harsh. I don't think I've ever said to anyone, oh, your diet has created chronic UTI. I just think
mm,
that's not the case. It's something more specific than that. It could be genetic, it can run in the family. It could be just you've had IBS for many, many years. And a lot of my female patients who've had any kind of IBSD, which is obviously IBS with diarrhea, that's
mm,
a risk factor. Obviously, we know the risk factor sex is a risk factor as well, and also severe constipation. So root causes, yes, but they can be a combination of all of those.
mm,
But yes, I'm always looking at why did you get this awful chronic illness? Sometimes you just don't know. Sometimes
mm,
just not going to find that answer, and desperately trying to find it is going to cause more stress as well.
mm. So what is your typical treatment approach for an individual? I know everyone's different, but who's experiencing recurrent UTI, and how do you work in terms of with other consultants?
I think, well, firstly, everyone that comes to see me does a food diary. So obviously, we need to tick off the obvious ones. You're not going to get anywhere by eating an inflammatory diet. So obviously, we don't want loads of coffee, we don't want loads of alcohol, we don't want loads of ultra processed food. So we're trying to eat right to reduce inflammation and eat right for gut health and all the biomes. I think that's the first thing. I think the second thing I do, which is really important, and I call this the sort of the mop up. So, you've got someone who's literally in a war zone with this terrible condition. We want to do the mop up of what has happened around maybe antibiotics or stress. So I do a complete MOT of bloods. So,
Mm,
you can't be walking around with this condition with low vitamin D, low B12, low folic acid, low zinc. We need to make sure that everything is fine, and that your body is really working to really support your immune system. So
mm,
blood tests and diet would be the first thing. And then I think, some of my consultations are quite long for this, so about an hour and a half. And we look at people's backgrounds, their environments, their relationships, their support systems, and their stress and their sleep. And we can see really what the trigger factors might be. I mean, you can eat really, really well. And if you have horrendous, hideous stress in your life, I mean, some women I see who come from abusive relationships, this type of thing, and I need to know that that's going on in the background. Because if
mm,
that's going on in the background and you're in fight or flight the whole time, your body's going to be bathed in cortisol, and this condition is not going to get better.
mm,
So I think it's a combination of all those factors. I'm in touch with most of the consultants, and depending on, it's not really up to me, it's then up to me send them back to their GP and say, well, these are the consultants which are really good. This one's near you. This one's got a year's waiting list. This one might work better for you. And then if I feel that the condition is really chronic and we're not getting anywhere, then certainly I would, suggest they go and see somebody who obviously will look at microbiology, antibiotics, etc., in more detail.
Yeah, interesting. So typically, how long can a patient expect to be in the treatment process?
Well, usually I do a consultation called the MOT, which is exactly what it says on the tin. So it's a good landing space to be. So people come basically to see me and they dump everything on me for an hour and a half. You know, there'll be tears, there'll be frustration, there'll be anger. We'll go through everything, and it's a good landing place to say, okay, well, actually, we don't need to focus on that. We need to focus on this bit, and this bit is a bit that you haven't been focusing on. And I think particularly with stress, people adapt to it and they don't realize that they're in a stressful situation until someone else comes along and goes, you're really stressed, you know. So it'll be an initial consultation, and then depending on private testing, sometimes we do stool testing, microbiome testing of the bladder or the vaginal microbiome as well. Those results usually take about 2 weeks. And then if I've written to the GP and asked for loads of blood tests, probably there'll be a follow-up about 3 or 4 weeks later where we assess everything. And what I'm trying to do is not cure the chronic UTI, but try and relieve the stress and the sort of, do you know what I mean, the sort of spider webby bits about it. Are you sleeping okay? Are you making sure that when you're going into a stress response, what tools have we got? A lot of people go for EMDR, trauma therapy, psychotherapy. We use tapping, just anything to try and get you out of this fight or flight. So long answer to your question is usually about at least 2 or 3 sessions. And it depends. And once they're on a regime that we hope works, then that's sort of it. And then people check in if they feel that they've had a stressful event, or they're going downhill, or they've just had a couple of months of just eating junk food and they just want to check in again. So usually about 3 sessions.
Okay. I noticed your emphasis on the mind-body connection and gut health. Do you have any advice on helping to prevent these UTIs in the future?
Gosh, that's a really good question. I mean, obviously I have my opinion, and there'll be all the consultants and the microbiologists which have their opinion. And I think moving forward, I am very, very much hoping that the very first signs of this, the very, very first time anyone gets this, it's treated correctly. And it's very, very difficult because, as you know, a lot of my friends are GPs and they say, but Kate, you know, antibiotic resistance. And I said, yeah, but there's a sweet spot at treating correctly, getting the right information, and not getting into these sort of catch-22 cycles. I mean, obviously not going into too much sort of detail in terms of antibiotic resistance, but it's huge. It's a big, big problem. So in answer to your question, I mean, there's so many things that I'd like. I'd like dipsticks that worked for patients. I'd like them to be able to dip it and absolutely be sure that there's an infection or there isn't. I'd like them to go up from 50% efficacy to 90% efficacy. So we need new dipsticks. The urine testing obviously needs to be a lot better. I don't want people to feel that this is something that you can never ever recover from, because I think this is such an extraordinary condition. And I see people who are going through chemo, having mastectomies, and it's kind of interesting because I had a lady last year, and she'd had a really rough time with breast cancer. She'd had a double mastectomy, and she'd had reconstruction surgery, and then she got this condition, and she said this condition was worse. And I think when you hear that, you think, oh boy, because you know, there needs to be a clear path of action. You know, there needs to be a clear defined path of, okay, what are we going to do? What's the plan? Rather than leaving people with this sort of chaotic sort of nothingness of, oh my goodness, I don't know what this is. I don't know where to go. Is it ever going to go? So I think people who have this condition need close monitoring, obviously, and they need huge amounts of support. And it's almost impossible to describe it to somebody who has never experienced it before. I think For example, I think with cancer, I think most people go, oh, I know someone who's had cancer. And it's not that cancer is better in any way, but people recognize that more than they recognize this. And I think still, and one of my bugbears is still that even in the perimenopausal and postmenopausal social media platforms, I don't think UTIs are talked about still enough. I think they're right down the list. I think hot flushes, night sweats, vaginal atrophy, vaginal UTIs, they're just talked about as sort of key in the door urgency. You just think, really, they can get a lot worse than that. So, I mean, I have a lot of hopes. I have a lot of hopes for vaccines, for different investigation processes. And I think they're on the cusp, but I still think we've got a few years to go yet.
Yeah. How can patients get in touch with you if they would like to?
Well, they can get in touch. I'm actually live in Sussex. I have a clinic in London. I tend to do a lot of virtual Skype, WhatsApp, Zoom consultations at the moment because I have clients from all over the world. So it's much easier. I'm Kate Arnold Nutrition, very easy to remember, .co.uk, and I'm based down in Sussex.
Amazing. Well, thank you, Kate, for providing us with some valuable information on the connection with the gut, the mind, and recurrent UTIs. We'll include details in the description below for anyone who would like to get in contact.
Thank you so much for having me.
Thanks so much for watching. I hope you found this video helpful. You're always welcome to reach out to us for more information about clinicians who specialise in recurrent and chronic UTIs. Our contact is in the description below. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTI-free.com for other articles on recurrent UTI treatment options. Of course, if you like what we're doing on this channel, make sure to hit the subscribe button here on YouTube and tick the bell so you get notifications about future videos. Thanks so much for joining us on our Clinician Insight series. If you have suggestions for who we should interview next, be sure to drop us a comment.